Hello everyone, I am Dr. Jyotsna, Consultant Obstetrician and Gynecologist at 9M by Ankura Hospitals Gachibowli. Today we'll talk about what are the causes of repeated pregnancy losses and miscarriages. 30% of all pregnancies are lost even before they are confirmed, and out of those which are confirmed, 10 to 15% are lost. Those who've had one miscarriage can have a repeat miscarriage 10 to 15% of times, and those who've had 2 or 3 miscarriages can have again a miscarriage in 40 to 50% of times. So it's important for us to evaluate when somebody has had repeated miscarriages. What is repeated miscarriages? When someone has had 2 or more miscarriages or pregnancy losses, we call it recurrent pregnancy loss. And the causes of this are many. Most of the miscarriages or pregnancy losses occur in the first trimester, that is within the first 3 months, and the causes are usually genetic. When I say genetic, it could be chromosomal or a gene mutation. Chromosomes are the genetic material carriers. Each of us there gets 23 pairs of chromosomes, 1 pair from each parent. If there is a change in the number or structure of these chromosomes, there could be a genetic defect in the embryo, and some of these can continue with the pregnancy but will have serious genetic defects, but most of them are lost in the early pregnancy itself, that is in the first trimester. There could be other genetic defects like a gene mutation which is inherited from the parents or which has spontaneously occurred at the time of fertilization, and that also can lead to a miscarriage. So investigation into genetic defects is a vast variety of tests, and that can be very exhausting. So we need to look at the causes and go about it in a stepwise manner. Another cause of pregnancy loss is hormonal. It could be like a progesterone deficiency because of lack of progesterone at the 6 to 7 week time, when the corpus luteum or the ovary which is secreting progesterone is giving over to the placenta, and during that period a lot of pregnancies are lost. That can be sorted by giving a little bit of progesterone support. But there are other hormone deficiencies like a thyroid disorder or diabetes, which is an insulin hormone defect, and these also can lead to miscarriages. Other nutritional factors like a folate deficiency, folic acid, vitamin B12 and other B complex deficiencies, vitamin D deficiency have also been implicated in increased risk of miscarriages. The other causes for miscarriages are uterine shape abnormalities, where there is a defect or a difference in the shape of uterus by birth, distortion of the uterine cavity due to fibroids or any adhesions formed due to previous uterine surgeries. These can lead to second trimester miscarriages. Other medical conditions like those which predispose a woman to blood clots like lupus or antiphospholipid antibody syndrome can cause placental dysfunction or clots in the placental vessels, which lead to disruption of blood supply to the fetus and cause a miscarriage. Then there are environmental causes like exposure to toxins in your workplace, or you're taking some drugs or medications for other medical conditions like anti-epileptics or neurological medications, which can cause folate deficiency and a miscarriage. Use of alcohol and recreational drugs is obviously forbidden. Those can cause to repeated pregnancy loss when you are not planned for a pregnancy. There are many more causes which can be investigated depending on the absence of all other causes. So when we see a woman with repeated pregnancy loss, we go in a stepwise manner trying to eliminate all the common causes, and if we don't find any other cause, we test for some rare causes like genetic defects which are not very common. So in the evaluation of all this, it is an exhausting, long process, can be expensive, and it should be taken up only if someone has 2 or more miscarriages. How can you as an individual prevent miscarriages? What can you do? So what you can do is have a preconception check. First, rule out if you have any medical conditions which can predispose you to a miscarriage like diabetes, thyroid. Do a basic blood workup, look for anemia, correct all nutritional deficiencies, and then Start taking folic acid even before you conceive, preferably from the time that you plan to have a child. Folic acid is a B vitamin which has shown to prevent neural tube defects or defects in the formation of the spinal cord and brain, which are the commonest reasons for malformations in babies. And you should also talk to your doctor if you are on any medications for medical conditions such as asthma, epilepsy, any other medical conditions, and ask if you are using safe medications for a pregnancy. Maintain a healthy weight. Ensure that you exercise and eat a balanced, healthy diet so that your BMI is in control, because obesity is one of the major risk factors for miscarriages and abnormal pregnancy outcomes. Thank you.